Hello everyone, I am Dr. Krithishree. I have done my Masters in Psychiatry with a degree of MD Psychiatry and I am working as consultant psychiatrist in KMC Hospital, Mangalore. Schizophrenia is a chronic mental health condition. This is a condition characterized by a combination of symptoms. It has positive symptoms like delusions, hallucinations, and paranoia. Negative symptoms like reduced emotional expressions and emotional blunting, also amotivation. Then disorganized symptoms like confused thinking and speech. Coming to treatment, here schizophrenia would require lifelong treatment. They are treated with medications called antipsychotics. Along with medications, non-pharmacological mode of treatment also play a vital role, especially in educating the family members, that is supportive psychotherapy, psychoeducation, which helps the family members to understand the patient condition and reduce the expressed emotions towards the patient. Then once the patient is relieved of the core symptoms, that's the positive, negative as well as the disorganized symptoms, psychoeducating the patient regarding about their condition will help them to stay compliant with the treatment as well as like regular follow-up for the treatment. Then coming to social skill training, this also is a focus after once the symptoms come under control. Finally, integrating the patient into the society by means of providing good support and housing is also important. Though conditions like schizophrenia, bipolar affective disorder, traumatic conditions like post-traumatic stress disorder, all are chronic conditions with disorganized behavior. They are different from each other. Schizophrenia and bipolar disorder is a psychotic illness, whereas trauma-related mental illnesses, neurotic spectrum illness, means conditions like schizophrenia and bipolar are mostly they do not have touch with reality. However, in bipolar disorder, the core symptoms are related to the mood. Where bipolar is, they will have both the symptoms of mania and depression, mostly like mania and hypomanic symptoms, where the patient remains either elated or irritable on with or without minimal triggers. So in bipolar disorder, it's mostly mood symptoms. However, coming to schizophrenia, they have the core symptoms here are delusions and hallucinations. Delusions means here the patients will have false fixed beliefs, paranoia, despite the contrary. Coming to hallucinations can occur in various modalities. The commonest one seen in schizophrenia, auditory hallucinations and also visual hallucination in some cases. However, modes of hallucination like gustatory, tactile, olfactory hallucinations are also known. Coming to trauma-related conditions like post-traumatic stress disorder, acute shock, adjustment disorder, these mostly have a combination of mixed anxiety and depressive symptoms along with sleep disturbances, hyperarousal attacks, flashbacks of the event, traumatic events what they have undergone. In all these three conditions like schizophrenia, bipolar or traumatic mental illness, it affects the overall functioning. However, they are very different in their symptoms. Hallucinations are hearing of voices in the absence of stimuli. Here I am telling voice hallucinations can occur in any modality. Like it can be auditory hallucinations, visual hallucinations, olfactory, gustatory, tactile hallucinations. That is, in all five senses, the perception can be felt without the stimuli being there. So this is called as hallucinations. In case of schizophrenia, it is mostly auditory hallucinations. In some cases, even visual hallucinations are seen. Coming to deranged thoughts, here the patients will have thoughts with derailment. Coming to disorganized thoughts, here the patients will have derailment, circumstantial thinking or formal thought disorder. Here patients will have fragmented thought process which are illogical and loosely connected. Medication in schizophrenia plays a central role in the treatment. These pharmacological agents are usually dopamine antagonists or partial agonistic action they have. This usually focuses mainly on the positive symptoms like delusions and hallucinations, and to some extent it also helps in the negative symptoms. Coming to psychological interventions, it usually complements the medications. Here psychological interventions like psychoeducation, family therapy or social skill training or focusing on rehabilitation helps the patient to improve coping skills, social skills, also their compliance, reduces relapse. Also, it helps the patient to have a better quality of life. Supportive strategies like family intervention, psychoeducation, helping social skill training and vocational training play a vital role as a non-pharmacological mode of treatment in cases of schizophrenia. This helps to reduce relapses, increase treatment adherence and compliance, improve the quality of life, integration of the patient into the community, as well as reduces the expressed emotions from the family members towards the patient.